Hi, everyone. I will be super quick because I think you're running a little behind. And I could spend hours talking about the hospital. That's what you want, right? Yeah, okay. I got it. You're looking for the file. Is it? That's okay. I'll just go ahead and start. I know what the slides say. So I think the first slide talks a little bit about our history at the Johns Hopkins Hospital. And you've heard some of this before. Mr. Johns Hopkins, wealthy businessman in Baltimore, didn't marry, didn't have children, left his money to found a university and a hospital with the idea that the School of Medicine would work together with the hospital. That was a novel concept. Oh, thank you. Oh, look at you. Okay, great. Thank you. Novel concept. So guys, we were the first academic medical center in the world. We were the first academic medical center. And when he wrote his letter to the Board of Trustees, he specified two things. First, he said that you will build a hospital that will provide care for East Baltimore. That was number one on his list. So we are the community hospital for East Baltimore. And then second, you will partner with the School of Medicine to make sure we train the best physicians and all care providers, to be honest, in a spirit of discovery and cutting edge science. So as I will just tell you, as a hospital president, I work hand in hand. My boss is Kevin Sowers, the health system president, and we are lockstep with the School of Medicine. We're all aligned, and I will tell you, first of all, the hospital is nothing without you all in the room. You all are what make it great. The patients come to see you, so thank you for that. And we'll do everything we can to support you guys in your work. This is just a quick picture of the first wards on the hospital, a little bit more about the history that I think you've heard about, but I'll give another nod to history. On the ward, see the big windows? John Shaw Billings, who designed the hospital, knew that fresh air was good to prevent infectious disease. COVID, hello, we knew that. We knew fresh air was right. And Sir William Osler, our first physician and chief of the hospital, would take his trainees, go down one side of the hallway, turn around, and come back, making his rounds. The first graduates of the School of Medicine actually trained here and lived in the dome on the upper floors, and they were called residents. Here's where history was made. So a few stats about the hospital. We have a lot of designations. We're proud of our work, whether it's a trauma center, whether it's magnet designation, Ebola research center. We just toured our biocontainment unit with some visitors from France today. We really are proud of all the good work that goes on here. A few numbers about the hospital. We're a big hospital, 1,000 beds. So most hospitals are 100 or 200 beds. A medium-sized hospital may hit 400, 500. We're 1,000. And you can see other stats, 11,000 employees and so forth. I'm going to skip this. You'll meet all of us. Here's where you could get involved. If you're interested, this is the governance of the hospital. So you'll see at the very top, the Johns Hopkins Hospital Board of Trustees, and right below that is Medical Board. Medical Board is our medical executive committee. They make decisions about clinical programming in the hospital and our policies and procedures. Medical Board is comprised of the clinical directors. So your bosses, whether it's the the director of medicine or surgery or pediatrics or otolaryngology, they are the medical board at the top. And then below is just a host of committees that do policy work and feed up different recommendations to that medical board. And all of those committees are populated by certainly physicians and faculty members, by pharmacists, by nurses. So it's a really robust process. We're not going to go through. Do you want a job description of each committee? I don't think you do. I'll just use it. Priorities for the hospital, very quickly. These are my last slides. Growing capacity. We need to grow. We have a finite physical structure, but the demand for our care is incessant, coming in from the HOW line, from the ED. So we're figuring out ways, lots of initiatives on the left if you want to get involved, of how we can maximize our capital infrastructure and get in more patients who demand our care. We want to be the destination of choice for patients, which means we want to provide the right experience for our patients. And by experience, certainly the niceties of the hospital. Is the food hot? Did you answer my call bell? But more importantly, what are the outcomes? What people want convenience, they want access. These are things we're working on. Our workforce, healthcare workforce is in crisis right now. We are absolutely in crisis. The Great Resignation hit healthcare perhaps harder than anywhere else. So lots of programming around how do we value our staff? How do we make sure their environment is the best environment? How do we make sure they're appropriately compensated for their work? We're working on diversity and inclusion in the hospital and workplace safety. You know, it's an interesting societal moment. There's a lot of violence in the EDs, in the hospital walls, so how do we make sure we keep our staff and faculty safe? Quality and safety goes without saying. Many of you are leaders in this field. So we want to be not just good, not just excellent. We want to be number one in quality and safety. And, you know, we can say, oh, is that U.S. News and World Report? Oh, maybe, sure. But when I look at quality rankings, they're not the most robust. I think about other things like Vizient, like Leapfrog, like CMS stars, but we will be the best. And then my last slide is caring for East Baltimore. Going back to that initial mission, we have so many programs. These are needs assessments, and I'm sorry I'm speeding through this. I'm just trying to get you back on time. But we actually go out into the community and do focus groups, surveys. We go to community leaders, church leaders, politicians, regular folks who live on the block and say, hey, what kind of health concerns do you have? On the right, in the blue, typical things, behavioral health, chronic diseases, diabetes. But on the left, we are hearing more and more we need help with the social determinants, housing, jobs. And this slide tells you all that we're doing, including, I will sum it up, hiring returning citizens coming out of prison that check a box and can't get an interview. We hire 100 a year at the Johns Hopkins Hospital. We work with community organizations. Number 2, permanent sustainable housing. We partnered with Healthcare for the Homeless in Baltimore City to provide 200 homes. Huge success. We provide all the wraparound services you need. We saw 96% were still in their home at the end of 3 years. Decrease, great satisfaction among our citizens in Baltimore who are suffering from homelessness. Decreased ED utilization, so we're going to do another 100. And then finally, working on mental health with a great program called GBRICS. So I'm going to leave you there. I just want to make a last plea. I'm sorry to speak so quickly, but welcome, welcome, welcome. Anytime you want to get involved at the hospital, we would love to have you. We're excited you're here because you're going to continue to keep us as great as I know we are. Thank you.